There are new warnings of an epidemic involving a dangerous and contagious disease. The Centers for Disease Control says cases of whooping cough are rising sharply in the U.S. Nearly 18,000 cases of whooping cough have been reported in 2012. It's a highly contagious bacterial infection of the lungs that can be deadly and especially dangerous for children. We could be seeing the worst outbreak of whooping cough in more than 50 years. Dr. Len Horovitz, pulmonologist at Lenox Hill Hospital in New York, joins us this morning to talk all about it. Len, good morning to you. You mentioned that you actually know the sound. You can imitate what this sounds like. What are we talking about here?
We're talking about a cough that's so violent that you cough so deeply as almost to vomit at sometimes, and then when the air rushes back in, it has a violent sound. I'll show you. Cough really hard, like, and then there's a
right,
as you try to get the air back in, and that's the whoop. Is the actually inspiration is and that's the mark of the whooping cough.
And very, very common in children. So you see the trend, you see the numbers. Should parents be worried about this?
Absolutely. Parents should be vaccinating the children, and parents themselves should be sure that they get a booster as well, because they're vulnerable, perhaps having lost their immunity.
And let's go back, we'll talk prevention in just a little bit, but let's start here. A lot of parents are going to want to know what in the world is happening. Why the spike now?
There's always a fluctuation in the incidence of whooping cough. There's about a 3 to 5 year incidence of ups and downs, and these things are always with us, just like tuberculosis is with us. They've always been around. It's just that now we're seeing a resurgence, perhaps because the vaccine may not be as effective, perhaps because the bacteria may be a little bit more resistant to the vaccine, perhaps because people aren't immunizing their children, for all these reasons.
The vaccine may have changed a bit or may not be as effective. You just mentioned that new one introduced back in the 1990s.
That's right. In 1991, the vaccine was changed from a whole pertussis vaccine, which was causing some problems with fevers and rashes that parents were objecting to, and the acellular pertussis vaccine became available, which people thought was just as good. The Journal of Infectious Disease in 1999 looked at about 5,000 kids and adolescents, and their immunity seemed to be fine, and the rate of attack was very low. So the new vaccine seemed to be perfectly fine at that point.
Is there the possibility, though, that parents don't even know exactly what to look for, or by the time they find it, it's too late?
By the time the whoop develops, it is too late. The initial symptoms are just very mild, like a cold, a runny nose, a sore throat, the kind of thing that you might not necessarily bring your child to the doctor for.
Prevention, you say everyone needs to be vaccinated.
Everyone needs to be vaccinated, especially adults who haven't been vaccinated since, let's say, their adolescence. Anybody age 18 to 64 should have a Tdap vaccination.
CDC says only 8% of adults have been vaccinated. That's since that new Tdap came out in 2005. That a big reason for the problem?
That's a reason for the problem, and you see vaccination or the lack thereof in every epidemic, be it an influenza epidemic. A lot of people don't believe in putting something foreign into their body, and so they'll refuse a vaccination, but they'll smoke.
And quickly, in the last 15 seconds that we have here, if you think your child has whooping cough, what do you do?
Bring them to the doctor. Have the child seen. There can be damage to the bronchial tubes or the lungs that's permanent, so you want to do the best you can to treat with antibiotics if, in fact, antibiotics still have a chance at that point.
All right, Dr. Len Horovitz joining us this morning. Doctor, thank you so much.
Thank you.